Hi, and welcome to the Edwards Project. What we're doing here is exploring all of the ideas, programs, people, organizations that have gone into the basic mission of building a pipeline of professionals in medicine from populations that don't traditionally get into careers in medicine. Earlier this year, we hosted the Cardiovascular Inquiry Panel. What's the history of this panel? How did it come into being, and what's its purpose?
It originally started as a physical diagnosis seminar combined with, we were doing dissections of cow hearts. And I remember having to order 30 cow hearts, I think, for off of a supply site. And Bob Haney ran the physical diagnosis seminar, and then we had medical students helping us come in and run the anatomy section of the dissections of the heart. And that probably started back in, I don't know, maybe 2012 or 2011 when we did our first one of those, and we did those at the high school, and that was really hands-on. Bob Haney and his wife Robbie were teaching kids how to do sphygmomanometers and stethoscopes, and how to take blood pressures, and also looking in people's eyes. And so they were doing with physical diagnosis stuff. And then Bob just has so much wisdom that it kind of developed into more of a panel discussion. Is that about right, Sarah?
Yeah, yeah. And then it also was an opportunity for many alumni from the high school to come back who were at various stages in the Jones C. Edwards pipeline in undergrad and medical school, to come back and talk about their experience with, students in 11th grade who are looking to start applying to college and really making some important decisions within the scope of the next 6 months of their lives, and just having that feedback and understanding kind of where people who have been in their shoes, where they went and how they handled the pressure and stresses of the first years of college.
So, on this panel, we had this continuum. And Suhib, maybe you could talk a little bit to this, going from being an Edwards scholar to now being a physician, and then sitting on that panel and kind of like looking back on this continuum of students. First of all, what was that like? And then secondly, what do you think that brought to the high school students watching?
I'll definitely say it's a full circle moment. I actually loved going to the panel, so I would probably my, I don't know, 10th panel attending, mostly as a Jones C. Edwards scholar coming back to talk on the panel about how it's like in college and medical school. But getting to sit now, having completed the whole pipeline, and see scholars or potential scholars right at the beginning, and remembering that I do remember the heart dissections with Dr. Haney.
Yeah.
Back in 2013 would have been for me.
Yeah.
And so it's really a full circle moment, and really, really, I'm really grateful for that opportunity that I had. And so it's hard to describe other than like a really warm feeling to see students at that stage and knowing how far ahead they have. Yeah.
I think one of the things you talked about was this love that you had for science, and when you were a high school student, I think into undergrad, and then how that kind of transformed into in medical school, that being about helping patients. What's the impact you think that has on students?
A lot of the times, students might have an idea in their head of what it means to be a doctor, what it means to practice medicine, and it's not exactly what it really is like. And being in those vulnerable moments with patients where they're trusting you with their life, with their health, and using your love for science and love for knowledge, the imperfect variables that you have in front of you, right? The patient gives you the symptoms they have, and it might not be the whole picture. You have your understanding of science, and it might not be the whole picture. But having to make the hard choices and decisions with each patient to go forward to figure out what to do for them and how to help them feel better and help them heal is rewarding, but also very heavy of a duty. And so I really wanted to convey that feeling that this is a real responsibility and a real duty, that you really have to be in medicine with your whole heart and with your passion.
Thought what was one of the interesting questions that came up to the panel was really about public speaking. It didn't have anything to do with medicine at all, but it just had to do, I think the comment was, hey, you guys are so articulate. Like, how do you engage in public speaking? I thought that was like really interesting. And I think that probably came from some of the students that were up there, recent grads. What were any other kind of surprises in terms of like the questions from students themselves?
I have to say, I was impressed at how thoughtful some of the questions were in terms of the barriers they were foreseeing of like challenges they would be facing in undergraduate. So they would ask specific questions of like transitioning, of types of study skills they would need to have compared from high school to college. And I thought that was really interesting, that they had such foresight, to going into discussion about medicine itself. And like, there was a specific question, I wish I could remember exactly how it went, but how I chose my specialty and like what made me interested in pediatrics and like how you go about exploring the different paths in medicine.
I think that the students are always, they're so starry-eyed, sometimes when they see people that they may have gone to school with on that panel in high school. Because a lot of them are graduating from the same high school. And so they kind of begin to see the narrative for them and the path that they could potentially walk. And it's them exploring like, okay, well, what does that really mean? Like Suhib said, it starts to dawn on them, I think, as they hear these words of wisdom, right? It's a real opportunity, I think. And you see that from the Edwards scholars when they're like asked to share their wisdom, share their experience with these younger people who aren't that much younger than them. But it's always impresses me how reflective and wise just a matter of a couple of years of undergraduate studies can make our Edward scholars. And so the questions I think that really elicit those responses are, like you said, Suhaib, it's kind of like, well, am I really going to have to study for 8 hours a day? And it's kind of like, well, and then the reality of it. So the questions are always like that. But I think that everybody's enthusiasm for medicine is something that is really like at 100% on those days. Junior year, physical diagnosis seminar at the med school, hanging out with my peers that are doing something that I want to do as a dream. And it's just like, how do you foster that, keep that enthusiasm alive, but also give them a dose of reality, right? So that's I think one of the benefits of that panel.
I think there was one of the topics that came up that was, I guess, academic rigor that it takes in undergrad into med school. Sarah, you work with a lot of students. How much of that is a factor?
Many of the students coming out of the high school will be first-generation college students. And so just that moment of high school graduation is such an accomplishment within their families. And it's very celebrated. And it's a enormous milestone for the students. And sometimes that can lead them to think like, I've done it. I'm successful. I have achieved something that was really hard to do. And that is, I'm not saying that's not true, but it's encouraging them to push through that false sense of like being at their peak and understanding that like stepping onto a college campus is going to challenge them in ways they have not experienced in high school. And so I think hearing that from near peer versus maybe a teacher or a mentor who's trying to like, come on, no senioritis, you got to push through. But hearing that from like someone who's been there saying, look, I came on to Case's campus and I had to really work. And so your senior year, you shouldn't take a lighter schedule. You should really push, even though you've done all the things you need to graduate. You should push beyond that because it's only going to make that transition easier for you as you start college.
One thing I wanted to just ask about was the Edwards Scholarship has a mission, and obviously there's a financial backing to that. That's very real. Why is it important to do this kind of program in addition to the money?
Yeah, that's a great question. I mean, there's so much that goes into becoming a physician, and I think that's kind of what some of this ground that we've covered already. That just from a pure stewardship perspective of the foundation, right? Our mission is to help students from Cleveland Metropolitan School District graduate with their MDs in 8 years, 9 years, 10 years. And the prospect of sort of selecting an 18-year-old to accomplish that journey by the time they're 26, I mean, the amount of change that a person goes through between those 8 years just personally, to expect them to have a clear idea and a clear path to become an MD at 18 is a pretty Herculean task, right? I mean, I think it's almost too much to ask. So these panels give us an opportunity, right? the Edwards Scholarship is out there. It's public. Everybody knows about it. And the people who are interested in it are very interested in it, right? Because it does represent a lot of money. And these students are going to graduate debt free. And to a certain extent, that's going to give them a lot of options in life, right? Assuming that they graduate with their MD with no debt, the economic pressure to select a specialty or a subspecialty is theoretically removed, right? There's social pressures, there's peer pressures, there's psychological pressures, but we can remove the economic pressure theoretically. So a lot of these 18-year-olds see that, and maybe they recognize it, not completely, but they're like, holy moly, that's a lot of money. It's a lot of prestige. I want to be a doctor. And so these panels are an opportunity to basically educate them a little bit on what it really means to be a doctor, and just a little bit, right? Get some experience from what our Edwards scholars are currently going through. These are the challenges you're going to face. Are you really ready for it? And then also from our side, start to understand the students. What do they believe? What do they really think? What do they value? What's their vision for their life? And is it compatible with what is going to be required of them should they get the scholarship? So the panels are just another opportunity for us to experience each other. It's an opportunity for them to see the narrative in front of them. I think a lot of this is about building a narrative for people they can identify with, and they can see themselves on this path. And then we have to be able to see them on the path as well. So I think that's fundamentally, that's partially why we do it.
So there's also a hands-on element to the whole thing too, right?
Oh yeah.
You talked about the dissections. We didn't do that in this particular panel, but why is that part of it important?
And I think it really gives the opportunity to practically and really help the students envision themselves being a doctor. And so I myself, along with my wife, who's a nurse, taught how to take blood pressures and the importance of blood pressure monitoring, especially in underserved areas where high blood pressure is the most common and it has a very serious mortality. How to take a blood pressure at home, how to know what the numbers mean, and what it means for heart health and public health as well. And so I feel like it helps students envision themselves being doctors, in addition to the panel of seeing their near peers just ahead of them going down that path.